All right, so good morning, everybody. This is the week where we kind of gonna do that test. I extended the test till next Sunday, so you have hopefully plenty of time to do that thing. I want to first go over questions that you have in regards to the material of the muscles and the bones. So let's just open the channel for that. If anything comes up, speak into me. Interrupt me and we can go to do that. I was also asked to go over the lower extremities a little bit more. So that's also something we can do. And then the second part, I want to go through the new material briefly and the structure of how we're having it after this bone muscle part is over. So on top, anybody have any questions, any concerns in regards to the second test that they want to talk about? Look at that. Everybody's all happy. That's good. Well, then let me take the reins here and share my screen with you. Let's see if I can do that. Lower. Share here. And let me see. Who was that? Somebody asked me impromptu about. Oh, Catherine. Are you there yet, Catherine?
Yes, I'm here.
Okay, so we want to talk about the lower extremity a little more, right? Is that right, Catherine?
Yes, just relating to your actual diagrams for the color label assignment.
Oh, okay. Not about functionality and all that, the material. That's okay at this point for you?
That's okay. It's just the perspective for your labeling assignment was a little hard for me.
Oh, let me go. I got to go do somewhere else then. Hold on real quick. I got to open that. Let me open that. Where am I? Where am I? No, not here. Modules. Sorry, it's a little slow with everybody on the call, but we're getting there. I was expecting to talk about the material itself. And of course, I'm very happy to talk about the material itself if you have any questions. Oh, look at that. I got to do some more grading here. All right. And so you were interested in the IT band is one of those, right? Catherine?
Yes.
Okay. So when I look at the, yeah, so you see my picture here?
Yeah, for this page, it was easy to see the IT band. I was looking on the page with this tibia.
The Soleus stuff, the lower part, okay. Yeah, where do you want to work with the IT? It will come out in here. See, here's the hamstrings coming down in the back of the knee here.
Okay.
And then the gastrocs are coming up here from calf upward, and they actually a little bit up into the femur. They anchor into the femur, and the hammies anchor into the tibio-fibula compound. And the IT band comes out. There's probably on this picture, probably this last little sliver here. This last little drawing here is the IT band coming, and it anchors right into the fibular head around here.
What about the bottom, the lowest picture? Is it there at all?
Oh, yeah, this is the IT band. Good one. This is the IP band right here. See that?
Okay, that's what I was curious
That's
about.
the IT band. Yes, as it comes down and then it anchors into the fibular head, which is here. And then we get the other muscles coming out in here, which I think this is the T. Yeah. And then the gastroc is in the back of here. So that's a very good question, because the IT band, you know, it's a thigh structure. It brings the muscles, the glutes in the back, the glute max, and then the TFL, the tensor fasciae lata in the front, and brings it into the IT band, and then anchors into the knee area, right below the knee, of course, a little. So what we can do with the IT band, we can swing that leg outward. So we do abduction really nicely with that. And then, of course, it helps a little with bringing the knee backwards and forward as well, or the thigh with the glute max. And then the TFL does a little bit of that forward, not too much, of course. Good. Okay. And then what else was there? Was there any other questions on that?
For the fibularis, are we supposed to differentiate between the longus and the brevis and the...
No, I'm not worried about that for this class. If you, it is a good one to differentiate, because if you have, let me go to the other pictures here. Let's see. Let me go to the lecture part real quick. So yeah, for this class, I'm not worried about differentiating it because it just becomes a lot of stuff to memorize. But it is an interesting, one to differentiate, because you do have the longest, the top one that goes and goes underneath the foot and anchors on the big toe side underneath the foot. So it really helps that stabilize the foot in that direction where we twist the ankle very often. So it helps with that. And then the brevis and the tertius, the other ones, they're also helping with that, but they don't go underneath. They just anchor on the lateral side of the foot here on the metatarsal number 5. And so that's the interesting part about differentiating those, and those are further down. But for you guys, don't worry about that in terms of being able to recognize it for the test. If you pick up that differential, that's great, because that, in an upper level class, that would be about the maximum level we would talk about this muscle. Okay. Any other one on this? No. Any other questions to this material?
Can you just go over the soleus and just kind of like where that is? And a lot of this, it's a little confusing to see in some of the diagrams.
Yeah, we may want to start right here, or no, right here. This is better. So the gastrocnemius is the top layer of the posterior calf musculature. Then when you take the gastrocnemius off, then you get into the lower one, and that's and you're right, there is not that great of diagrams here. See this muscle right here, this round thing here? It starts right in this part, this upper part of the fibula, mostly the tibia, but both of those, fibula and tibia, and then it goes and anchors into the calcaneal tendon, or the Achilles tendon in the back here. And then overlaying it is the gastrocnemius. So these are these two heads then lay over it. Unfortunately, I don't think I have to go online to look some other picture up. It's an interesting muscle group, because combined it's called the triceps surae. So you can see it here as it comes down from the front. This is from the front. The big one here is the gastrocnemius, and then in the front here you can see that soleus. So if you actually press in on the bone on the medial side, right below the bone on the big toe side, what you're touching is soleus muscle. It's that massive as it comes from the back, as it holds, as it anchors into the back of the thigh, but it shows up on the side here.
So,
the back of the calf. Sorry about that.
I have a question. So the soleus is like it wraps around the back of the calf, just under the gastrocnemius.
Wait, say that again, Sanjay.
The soleus, it wraps around the back of the calf, just underneath the gastrocnemius.
Yeah, it doesn't really wrap around. It looks a little weird here that it looks like it's wrapped. It's just a really thick, like this. It's named after the fish sole. It's really a thick muscle that goes from the upper calf in the back and goes and anchors into the heel, into the calcaneus, the heel of the. And what it does, it pushes. It helps lift the calcaneus up, so it pushes the toe down into the floor, which lifts us as a person. So it's one of those anti-gravity muscles that make sure we don't fall down.
I feel like I'm having a disconnect between this diagram and the diagram that's on the worksheet.
I completely agree.
Oh, look, hey, on the worksheet, it looks much better. So this is the gastroc, and I agree too. This is the gastroc, And then if you take that away, then this whole thing is the soleus. And if you take that away, oh, wait, you're not seeing that. Shoot, sorry about that. I hate this part of the Zoom. I can't flip windows without you flipping windows. So this is the gastroc here.
Yes.
You take that away, this is the soleus.
Yes.
This whole
Okay.
thing. All right. And this is actually a really good picture because actually clinically, because you can see right where the gastrocnemius tendon and the soleus tendon anchor together, and then they're one tendon after that. See right here where the fibers come together. And so the cool thing about that situation is you have one thick anchoring muscle that is only from the below the knee into the heel. So it can really work on that joint, right, directly. And then you got the overlaying muscle, the gastrocs here, that span that over that joint. And so what they then help is they support that pushing down of the toe motion, but they can also help in bending the knee motion, which is what the hamstrings do.
Yeah, perfect.
So it's biomechanically really a very cool setup that way, if you think about it. So yeah, I'm sorry about that. Then did you guys find it useful to look at the cadaver videos?
Yes, I use that and also online just searching.
Okay, no, that's good. I mean, that's unfortunately how, you know, we have to do it. Maybe my favorite muscle picture might be nicely showing the attachments on an electronic device, the different attachments of the gastric and the soleus. And in the injury prevention, that's actually the interesting part about how you stretch the calf stretching part. I don't know which number of the exercise that was, but the calf stretching, as you bend the knee versus stretching the knee, you stretch the two different muscles that way. And so that can clinically be interesting. Excellent. All right. Thank you for those questions. Keep them coming. Any more?
Can you just go back to the label assignment and show me the tibialis posterior?
Mm-hmm. The tibialis posterior. Let me see. Now you're challenging me. Oh, where am I? Hold on.
Well, because I didn't realize that that one picture was a layer taken away.
Yeah, yeah.
Now I'm confused.
Okay, where am I? Oh, here it is. Okay. Here's the posterior. So that's the soleus. And then that's the fibularis part. This part is the fibularis. And then that's the, wait, is that? Yeah, that's the posterior. That goes right into here. See that muscle here? That one right here. That goes right, if you follow the tendon underneath here, it goes right into this part of the medial foot. So that's the tibialis posterior. Does that make sense?
Yes.
And that's under the soleus?
It's, yes, that's under the, so you kind of have three layers in that back. You got the gastroc layer, which goes together with the soleus layer as we discussed it, but there are actually two layers, right? And then below that, when you take the soleus away, then you get this layer here. And so you got the tib posterior, and you can see how that goes. If you follow the, it goes underneath, but if you follow the tendon, it goes into this part. So then you know it's a tibialis, it's not a toe muscle, right? And then this one here, you see as it goes into the front here, it goes into the toes into here. So that will then be the flexor digitorum. But you don't have to do that, right? No, you don't have to do that. And then here you can see too, this tendon here goes up. So this one is a little bit more challenging in terms of tibialis posterior and anterior versus extensors, but I'm not too, that's why I only ask for one there. I don't ask for all the different ones there, but let me point that out here real quick. That's kind of next level. If you get those confused, don't worry about it. We often get them confused. But I like this picture about that a lot, where you can see the green goes right into the tendon here. And then the one that goes to the toe, big toe, will be the extensor hallucis. So you look at where they go. And then the finger ones, the toe ones, will be the extensor digitori or digitorum. And so that on that picture is visualized, and here, as you can see how it goes, this tendon goes underneath here and it anchors right into this part. And so that will be then the tibialis anterior. This one coming out here on the outside part goes to the toe. So that will be extensor digit joint, which you do not have to worry about. And then the big toe one is going up right here into this small sliver. So that will be about, if you take a Bio 2 class, if you're not going to get deeper than that, I don't think, on the level of muscles. So if you know that level, you're in good shape, like really good shape, including clinically in good shape. I mean, I had seminars, continuing education seminars, where we had a physical therapist and a chiropractic seminar who had both TCN and PT. And he asked the question, the guy was talking about the triceps in the calf. And he said, isn't the triceps in the arm? Not realizing that the triceps, as we already learned, is the gastrocnemius and the soleus combined together. And so you've already reached a level that so many practitioners don't even remember anymore when they go to clinic after 20 years or so. So that's, you know, not to make it, not to scare you or anything, but just tell you how complex this stuff is. So if you feel overwhelmed now, that's a very okay place to be. Just do the best you can. And a lot of the information will stick, especially if you go through the exercises with coloring and labeling and, you know, spend some time on it. Anyway, there's my little pep talk. Any other questions to this material? We can also talk more upper extremity if you want. That's okay too. No? Well, if not, I think we can go and, well, if not, number one, if you haven't taken the test, which most of you haven't, which is okay, sorry, I shouldn't show that. Why the heck is that showing? Then I want you to please go through the last two Zooms and move to where the quizzes are and do those. I said it multiple times, but I want to reiterate that again. Go through those before you take the test, because I do go through stuff in there that is sort of tips that can help you a little more along. And other than that, I let you go do that test. If you have any questions, just shoot and ask me now, or shoot me a pronto. I'm happy to answer them. No problem about it. A test in my world should not be a punishment. It should be something where you can show the knowledge and apply it in a way that is a bit more challenging. That's sort of how I look at it. And the ones who've taken the test so far, you did phenomenal. So don't, you know, just, you're doing a great job. So, but after this week is finished, we're going to move into the third part of the class. And the third part of the class has a couple of pieces to it. It's a lot of material that we go through. So what I have done is I've created a really, really solid test review for you guys to follow along. So before you actually go into anything in part 3 of the class, I want you to go into the test review of test 3, which should be open for you guys. And in there, I have these tabs again, as in the second test review, but in addition to the test, anatomy test terms, review videos, and then a link with picture models, I also here have a link to a test review that is about the sort of non-anatomy term part of the test. So all the stuff that's like physiology and things like that, that are in a multiple choice test and true false test, is on this review. And so I made a very extensive 4-page review or 3.5-page review that goes through every chapter that we're going to follow from now until the end. And that's then covered in the final test. I know it's hard to talk about the next test, but it's more about how to integrate the information and organize it. It's not really about that yet. So this week, we're going to go through the heart and we're going to go through the blood vessels. So when you work through your material, I want you to understand it, the videos, the bullet points. I'm going to go through that briefly, do the questions like always, but have this page here printed out if you could. And you find this page when you go to module test 3, test review, test review sheet here, then it gets you to this link. And if, no, not this link, different link. I don't know. It's coming, this link. And I want you, if you can, print that out or download it on a device, because when you work your way through the material, after you've done the questions and integrate the material and understand it as much as you can, then I want you to focus on these bullet points and make flashcards or whatever, but make sure you understand all of those points well, because these are the ones that will come back on a test. All the other parts in a chapter, I want you to have understood. That's always helpful because they come back later in a different class, but you don't have to worry about memorizing it for the test. So that's how I get around trying to make this third part of the material, which is quite extensive, integrated in a way that we're not wasting too much time on tests. Because I think, as in, online it's all right, but it still always takes a lot of time away. And so that's one reason why I don't want to worry about doing that. Again, if you have any question, what the heck just happened? If you have any questions, please just speak up. All right, then if we go further into, so this is for the whole third part of the class, is this test review stuff in here. So then if we go into week 9, oh, and one thing, unfortunately, and I do need to write an announcement about it, we do not have the ability to have the dissections. I'm really, really sorry about that. That just cleared itself up over last week, and it's just too complicated and too cumbersome to figure it out for an online class. I was able to do it in a different school, but it just seems to be a bit sluggish here. So I'm really, really sorry about not being able to produce that for this semester. So, and I will have to write an announcement because I know some of you are really looking forward to that. So was I, and I'm really sorry about that. But back to week 9, we will talk about the heart, the blood vessels, and then the lymphatic. So we'll start now talking about the cardiovascular system, and then we're going to go into the immune system as it relates together somewhat. And then we move into we also then do endocrine and integumentary, which is the skin and hormones. And then from there, we move into the brain and the nervous system, which is really cool. That where we spend a little bit extra time on that, I think. And then from there, we finish the semester off with respiratory, the breathing stuff, the digestion. We have a little on nutrition, which is also kind of nice, I think, as an overview. And then we talk about the urinary system, and then end up with the reproductive system. And we do have a section on the embryology, which I think is also really a great little foundation knowledge base about the baby stuff, which when I had the booklets, I always tell the majority of my students were women, and when they had kids or were pregnant, I say show this chapter to your husband so he knows a little bit of, or your boyfriend, so he knows a little bit of what you're going through and what's going on with your body. So I'd put that in there. Maybe I should extract that from the booklets and just make like an online little thing about it, because it is helpful, I think. Every class has in every week, and by the way, next week there's a break week coming up. So next Monday is, I think, break. Is that correct, or am I wrong with that? If somebody could confirm that for me, because then we don't have a Zoom on that week.
Yeah, next week is spring break.
Next week is spring break, right? So next Monday, we do not meet on Zoom. We're going to come back the following week. So you actually have this week to finish, the test, and you can table all of this, right? We talk now until you finish that. If it's too overwhelming, you have an extra week to work on that. I know it's break, but you still have a week's time. And then the week after, we'll meet back up. So anyway, we have this, now we're doing heart and blood vessel this period, this week. And here are the questions, as always. We have a label coloring situation, as always, in here. We'll finish up the injury prevention stuff, evaluation with a little discussion on it, just the same thing. How was it for you? How is that, and so forth. Oh, and I think I figured out why some of your grades just dropped dramatically, because somehow when I import some quiz type stuff like test 3, and somebody pointed it out to me, somehow the dates didn't get removed on some of them, so I removed all of that. So hopefully those grade numbers are going up. But please, please, please do understand, if you do all your work, until I have this great thing figured out on Zoom, on Canvas, unfortunately, it's not always reflective. So if you have concerns, just reach out to me on Zoom, on Pronto. I go in and look what it looks like for you, and assure you that you're doing just fine. But if you're doing all your work, you're doing just fine. And a lot of it is graded on completion, and not necessarily graded on every little thing is fully accurate, or your paragraphs are written so well in English and so forth. I've also went back into some weeks, early weeks, and did change some of the discussion scores to add those 2 points that, was the reply kind of part. So just keep an eye on those. If I'm messing up someplace, reach out to me. It's a lot of background sort of adjusting. So if I miss something, please be my canary in the coal mine for me as well, as much as I try to be yours. So, and now the last thing for this week is we are starting a pathology project. And a pathology project goes about 6 weeks long. And so what it is basically is a place where I want you guys in a group to do some research about a kind of a common pathology that you like to talk about or like to research a little more. Like, somebody has back pain, or somebody twists their foot all the time, or family members have diabetes that you want to know more about, or maybe some of your children have asthma and you like to know more about, or there's, these days a lot of anxiety, a lot of depression, for example, also mental pathologies, which are very important, and have a lot of influence on the other parts of the body, the physical parts of the body too. So that's why I think it's also very cool that we're, paying more attention to our mental states and vulnerabilities. And so what I want you to do is I want you to, in your groups, the anatomy groups that you made, I want you to come together and say, hey, what pathology would we want to talk about or research more? And then you research that on the web, with some, .org.edu type stuff, not stuff that just, not websites that just want to sell you things at the end, because they are just going to gear their knowledge that they give you towards what they want you to buy. So that's a little bit challenging sometimes. But I want you to do a little research of what is the pathology? What am I actually talking about when I say I'm anxious? What's going on? Or I have back pain, or a cancer, or asthma, or so. Cardiovascular is also a good one. High blood pressure is also important because it's very, very prevalent in our society. And then after researching the pathology, and I want one person in the group to do that, and then another person, and you figure out who's doing what. You negotiate that with each other at first. Then you also look into how does conventional medicine treat that pathology. And the reason why I'm actually making this exercise, because I had a student who missed the test, and her son apparently had to go to the ER. That's why she missed the test, with an asthma attack. And I asked her, so what did they do? And she says, well, they gave me some albuterol spray. And I'm like, really? Did they also talk to you about, how like carbs and carbohydrates, like sugar things and milk stuff, create more phlegm and increase that asthma? And she's like, no, not at all. I'm like, wow, we got to talk about that. And so that's when that kind of started. And so I want you to research, what's conventional medicine doing? Not in a negative that they're not doing enough, just to get an idea. And then how can I support the medical treatment? That's the third question. How can I support the medical treatment with lifestyle changes and or alternative interventions? Like back pain, sometimes you can do good stuff with an acupuncture or so, but we don't necessarily get to hear that in an emergency room when we're right in there. And so so that's the third question that I want one person or a couple of people in a group to discuss. So the three things I want out of this exercise is that we have some more knowledge about the pathology, about what medicine's doing or what conventional medicine's doing, and what else can we do to support that treatment. And then I want you to make a presentation, brief, not long at all. At the end of the day, I don't want this presentation to be altogether more than like 5 minutes or so, if I can have it my way, because I want people to actually listen to it, and that you understand yourself listening to videos. After a few minutes, it's a little harder to pay attention. But I want you to make a PowerPoint presentation explaining these points. And again, each individual person in the group can do that. And then as a group, you help each other out to make sure everybody is on the technological side apt to do that. And if not, you reach out to me and we can do it together. But there's a group score to the whole thing that encompasses that as a group, helping each other. But then each group member will make a little voiceover video of this research, and then we post those in discussions, and we talk about it, and we learn from it, and we'll have project discussion on it. So the first thing I need you to do is I need you to go into your groups under people anatomy groups and talk amongst yourselves. Talk amongst yourselves of what pathology you would like to do and research. And it doesn't matter if a couple of groups have the same pathology. That is not a problem. That's fine with me. And you can do, and then the other thing I want you to do is, I think I want you to tell me a group leader on it. So somebody who's a little bit in charge of it. And then while you start doing that, I want you to go and explore this group tab here, because in the peoples, you have these groups. And if you go on in a group, you can actually, I don't know about why, but if you go into a group, you actually have all these different abilities in a group that you can, all the stuff you can do in a group, which I had it uploaded here, but I don't know where it went. But you can, inside the group, you can create pages and have group documents and things like that. And so I think that will be very, yeah, I just don't know why I can't get there. Well, I think if you explore because I'm a student right now and I need to be in my group. Okay, so let me leave the student view. That's probably the problem. Okay. I still don't know where to go in. But once you're in that group thing, in your own group, over here, you're going to have a couple of tabs where you can communicate with each other. And you can also make documents together and so forth. Some of you have discussions. And so some of you have already used that. And you even have a button called the big blue button where you can have Zoom-like conferences. If you just go in there and make a conference, you can connect with each other and work with each other on things. So I think that's really interesting. And I'm not quite versed with that yet because I'm just myself learning about how the group tabs really work. So as much as is probably somewhat of a learning for you, it's also a learning for me. So reach out with questions and I can find a way around it in the background, etc. if you have questions, or give me tips, what you like and what you don't like about it. So anyway, that's the first part of this project. So the first thing now, this week, is really not much. It's just connect with your members in those groups you created, and then discuss with each other a disease that you would like to talk about, and then assign group members to each of the 3 groups. And if there is more than 3 members, make the group 3 more than 1 person, because in some ways that's probably the biggest thing to research depending on the pathology. And then once you decided, message me in the text box below which question you're researching, who is in what group, and then I'll score on that. I do have some groups where there's 5 people, and I'm gonna have to figure out how to make those groups 4 people. 2 groups have 5 people. So I'll reach out in the background over pronto who's all right to move into a different group or not. So we have 4 members per group mostly, and then hopefully only one group where there's like 3 members or so. But anyway, that's kind of how we want to work that part. How many members is not that pertinent at the end of the day for each of you individually. Good. Do you have any questions to that week? Silence. No, you guys aren't interrupting me. I must either do a really good job or must be so boring. So do you understand what I want from you?
Yes.
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 Yes. Yes.
Good. So then we can go do that. And I can let you go on your merry way. And so you actually have, you know, a couple of weeks for this whole thing. Well, no, that's not true. That's not true. Oh, you know what? I should change that. All the due dates. I should have thought of that. So all the due dates for week 9 that right now are Wednesday, March 27th, I'm going to push that one forward. So your due date on those things is after your break. Or the last week, the last day of your break. Let me see what that is. That will be...
The 1st? The 3rd?
Yes, the 3rd, 5/3. So that way, you don't have to worry about getting late. Make sense? So all of these will be moved to 1 week up. All of these 27s will be moved to April 3rd. Good. That way you have the whole time and you can focus on things at a time and not have to worry about this whole week and then you're late. Okay, good. Sorry, that was just sort of an internal error on my part. But with that, any final questions? Are you good?
Good.
Good.
Good. All right. Good. Have a wonderful day. I'll let you go.
All right. Thank you. Have a good day.
Thank you.
Thank
Have a
you,
good
Professor.
break.
Thanks,
Professor.
Professor.
Thank you.
Take
Take
care.
care. Be in
Good
touch.
Monday. Have a good week.
You too. Bye-bye.